Hello, and welcome to Grotto of Economics, the Cave of Knowledge. I am Dr. Bauer. If you do enjoy this video, please like it, share, comment, and subscribe. And a big shout out to all my economics students this academic year. I am pleased that you have chosen to study economics, and I'm sure that you will get the most out of that subject. In this episode of Growth of Economics, I want to talk about the UK National Health Service and how it can be improved. So what is the UK NHS? The UK NHS is a public service that provides healthcare that is comprehensive, universal, and free at the point of use. So what is the idea behind this universal provision? The idea lies behind an economic concept known as a merit good. So what is a merit good? A merit good is a good that has third-party benefits to society. It has third-party benefits to society. In other words, it is a good that has additional benefits to society besides the benefits that go to the person who consumes that good. So the benefit that goes to the individual in economics is known as a private benefit, while the benefit that accrues to society is referred to as external benefit. So the benefit for the individual is private benefit, and the benefit that goes to society is referred to as the external benefit. How can we illustrate healthcare as a merit good? So we can look at the private benefit and the external benefit. So when someone consumes healthcare, they have good health, they get it for themselves. They are fit to engage in economic activity, which is a benefit. They can participate in a sport or any recreation that enhances their well-being. As far as the society is concerned, the individual is fit enough to work and pay their taxes. The individual does not become a burden to society. Other members of the family are not tied up, caring for the sick. So that is the private benefit and the external benefit. So what then is the reason for the UK NHS? Okay, so healthcare is a merit good. That is why healthcare is a merit good. Left to market forces, it will be underprovided. Left to market forces, it will be underprovided. What does that mean? So if we left the demand for healthcare to the forces of demand and supply, okay, many people will fail or be unable to afford that healthcare. And under those circumstances, they will not seek healthcare, and healthcare provision will be limited. Hence, state provision will ensure a universal provision. When the state steps in, okay, everyone will be able to go forward and seek medical attention if the need arises. So what is the problem with the UK NHS? The problem is this, okay, there's unlimited demand for the services of the NHS, okay, while the supply is limited. So unlimited demand and limited supply. So there's this constant need for the services of the NHS. Meanwhile, the NHS operates with scarce or limited resources. According to the Economist magazine, okay, these are some of the performance indicators of the UK NHS. So it says what? Britain has fewer hospital beds per person than almost any other country, any other rich country. Among 18 rich countries, Britain has some of the worst five-year survival rates for killer diseases like lung, colon, and breast cancers. Across the OECD, that's the Organization for Economic Cooperation and Development, that's a group of rich countries. Britain invested the least capital per person in healthcare in 2015. That's according to the Economist magazine. So how can we improve the NHS? How can the UK NHS be improved? Now, there are three options that we can talk of. Okay, so we can talk of co-payments, we can talk of social insurance model, and we can talk of a situation where there's a general prevention of illness. Okay, let's take a look at the first option. That is the co-payments. So what is it? So basically what happens is charge more patients at the point of use. So if patients need to see a GP, they may pay a fee to have an appointment, some kind of fee to have an appointment. So what would be the benefits and the drawback for such a scheme? The benefit will be that it will ration health services and therefore reduce demand, because if people have to make a certain contribution, they may be unwilling to spend that money to see a doctor or to undergo a certain kind of operation, and such conditions will help reduce demand and help ration the healthcare services. What would be the drawback? So this will deter some patients from seeking care. So you're going to have in society some people who are ill, okay, and because they cannot afford the medical care, they may just not seek medical attention, and that can have detrimental effects. What about the second option? Okay, social insurance model, where employers and employees pay contributions into a not-for-profit fund. What will be the benefit? So this will help people feel more responsible for their health, which may mean that taking exercises, eating healthily, making sure that they don't put on weight, cutting down how much they drink and how much they smoke, and so on and so forth. What will be the drawback? So this will be politically risky, as it is a significant change. In many ways, it will require a significant change from the system we have right now. And not many politicians will be willing to take that risk and damage their political fortunes. What about the third option? Okay, a general prevention of illness. A general prevention of illness. What does that achieve? Benefit. So this will improve people's health and reduce the demand for healthcare. Drawback may require some increases in healthcare spending. So a general prevention of illness cannot just be achieved by just stating that as a policy objective or a policy aim. Some amount of money must be spent on the NHS, okay, to achieve a general prevention of illness. But it depends on where and how that increase in NHS spending will come about, and where that money will be spent. Okay, so how can we achieve a general prevention of illness? How can that be achieved? There are two main forms of healthcare provision. The first kind of provision is primary and community services. That's when we go and see our GP and nurses that work within our communities. That is a primary and community service provision. And hospital services that focus on acute illness. So that are the two main forms of healthcare provision. Now, what is the current pattern of NHS spending? Now, according to the Economist magazine, from 2015 to 2017, the share of NHS spending on hospital services increased from 63 to 65%. Okay, whilst that on primary and community services decreased from 20% to 19%. So that's according to the Economist magazine. So how can we achieve a general prevention of illness? For that to happen, we argue here that the share of NHS spending on primary and community services must increase. The share of NHS spending on primary and community services must increase. Okay, so what would be the benefits of such an increase and such a diversion of funds? Okay, the incidence of illness will reduce, okay, which will reduce the demand for healthcare. So if there's more spending on nurses in the community, more spend on NHS, okay, the advice and the guidance that these healthcare professionals can offer to individuals and households will help prevent them getting sick and therefore avoid the need to seek medical attention, serious medical attention. So this will help match the supply of healthcare services, which is limited. So when fewer people are sick and fewer people need medical attention, it will then be able to match the limited supply that the NHS has based on the fact that it operates with limited resources. So that is the argument we are making here. So what are our conclusions? Number one, healthcare is a very good and therefore has third-party external benefits. Number two, the UK NHS is designed to provide a universal healthcare for all, free at the point of use. Three, the NHS model suffers from unlimited demand and limited supply. And four, the best way to improve the NHS is to reduce the incidence of illness and therefore reduce the demand for healthcare services. Thank you so much for watching. I believe you've learned a lot about the NHS. Please put any comments you have in the comment section with any suggestions that you have. Once again, thank you. Please do subscribe to Growth of Economics for more interesting topics in economics. Thanks for watching. Bye.